Happy Sunday and welcome everyone to the Weekend Wellness Hour. Thank you guys for joining us today. I have a special guest, Carolyn Settle, who is a psychotherapist here in the Phoenix area in Scottsdale. And Carolyn, she has a great resume here. I'm going to go through it a little bit because she has done some amazing things. So she has been counseling children, adolescents, and adults for over 39 years and has worked in a variety of settings, hospitals, community behavioral health settings, and even in private practice, which is what she does now. Carolyn does a variety of modalities related to psychotherapy, including Gestalt therapy, psychodynamic therapy, cognitive behavioral therapy, and EMDR, eye movement desensitization reprocessing. So today we're going to focus a little bit on EMDR because Carolyn has a wide knowledge of this. She is an authority in this with adults, adolescents, and children, helping these people with trauma, depression, anxiety, phobias, and other conditions in life. She's actually an EMDR Institute facilitator, and she is an EMDRIA certified therapist and consultant, and actually trains people on how to do this. She's spoken all over the world in conferences and now teaches people, how to do this virtually as well. So please welcome Carolyn, and let's have her join us today. And thank you so much for coming on today, Carolyn. Really appreciate you coming and sharing some of your knowledge for all of the listeners here.
Thank you for having me, Amy.
Wonderful. Is there anything I left out? Would you like to share a little bit more about your background? Anything that I left out there?
No, I think you've got it all. I mean, I think the only thing that I would add to that is myself and my colleague, Dr. Robbie Adler-Tapia, not only are co-investigators on an EMDR study with children, and from that came our book, EMDR and the Art of Psychotherapy with Children and the Treatment Manual. So we have written 2 books about that.
Wonderful. I can't wait to dive in. So let's just go right in. So EMDR, I basically became familiar with it about a little over a year ago. And since then, I have many close people to me who have gone through this type of modality, and it's really benefited them from struggles they've had in their past. And so I've been curious about it over the past year, and I've reached out to people to find out, and then to meet you a few months ago and to hear, all of your knowledge and your research in it. Can you just share some of the basics of what it is first, and then we can dive in further?
Okay. Well, so EMDR, as you said, stands for eye movement desensitization reprocessing. It's been around for about 33 years. I've been doing it for about 26 years. And it was originated for post-traumatic stress disorder. But what we do know now about it is it also helps with what we call little t traumas, like I'm going through a divorce, or, we use it for any kind of abuse. So there's a wide range of operational to use that. So I'm not sure, are you asking me to tell you specifically what it does?
Yeah, we'll go into that. So as we're learning, it's for a lot of different types of traumas and distress. So what does it involve? I know that there's 8 steps, but what are some of the steps, or what is it that happens during this process?
Okay, so I think what I'm going to do is just give you my 3-minute spiel that when I tell clients. So, I'm a clinical social worker, so I'm a psychotherapist. So when people come in to see me, they don't always come in just for EMDR, although because I'm kind of known for that now, people do come in specifically. But if people don't know anything about EMDR, this is what I would say to them. So I'm just going to kind of give you that overview. So EMDR was originated by a woman, a psychologist named Francine Shapiro, and her purpose is she wanted to find the mind-body connection. She had breast cancer and was going through treatment for that. And she was also getting her PhD. And so she was taking a walk in the park, and she noticed, because she was analyzing everything for her dissertation and her research for her PhD, and she noticed she felt a lot better from that walk. And it was more than just that walk in the park. And so as she was analyzing it, she discovered she'd been moving her eyes back and forth. And what she noticed is that her thought process naturally moved from distress to a more positive thought process. So she went back to her fellow students and colleagues and said, think about something bad and move your eyes back and forth. And what she discovered is that most people can't just naturally move their eyes back and forth. So she would have them follow her fingers back and forth. Mm-hmm. And through this process, the first study is her dissertation. It's a controlled random study. And she developed the 8 phases of EMDR. And I'll go through that with you in a minute. But basically what she discovered is that she could have someone think about something negative and found that things were negatively stored in our memory networks in a maladaptive way if something traumatic happened. So a little vignette of how it would be, and I'm like shrink wrapping it, is that she would go into the veterans hospitals, and you know, back then, still some of the Vietnam vets were having flashbacks and nightmares, and so there's a series of questions that we ask. So she would say to a client, so what's the repeating thought process or the intrusive thought that you would have? And the guy would say, well, I keep seeing my buddy being blown up. And so when you think about that image, what's the negative belief about yourself? I should have done something. And what would you like to believe instead? I'd like to believe that it was war, I did the best I could. And when you think about those positive words, I did the best I could, how true do they feel on a 1 to 7? With 7 feeling completely true and 1 feeling completely false. Oh, well, it feels like a 1. Okay, and when you think about that incident and that picture, and I should have done something, what's the emotion you feel? Guilt. And how disturbing is that on a 0 to 10? It's a 10 plus. And where do you feel that in your body? I feel it in my gut. And so then what you do as a therapist, you say, I want you to think about that image, those words, I should have done something, and that feeling in your gut, and follow my fingers. And so you do this, nobody's talking for about a minute, and then you pause and say, what are you getting? And so he might say something like, well, I realized just before my buddy was hit, there was an explosion right to the side of me, and I was knocked out. Okay, go with that. Nobody's talking. Wow. And you pause. What are you getting now? Well, there's no way I could have gotten to my buddy. I was just coming to right when he got hit. Okay, go with that. What are you getting? Well, if it were my buddy, if it were me that died and my buddy had lived, I would want him to have a happy life. Go with that. So obviously I am super shrink wrapping this process so that you can get a framework of it, but that's kind of that's the assessment phase of EMDR. I just did the assessment and the desensitization phase, which is phase 3 and 4. So then we wanted to know, you know, well, we don't really know why it works, but there's all kinds of studies. There's over 300 studies, and I mentioned before I've been part of one of those studies. Right. We have 800 therapists all over the world that are trained in it, and there's ongoing studies that go on right now. But what we speculate, or why we think it works, is that it replicates REM sleep, rapid eye movement sleep. So every night when you're sleeping well, you have about 4 hours of your eyes going back and forth like this. If you have a dog or a baby, you can see when they're sleeping underneath their eyelids, their eyes going back and forth. And we know that when people are having good dream sleep, that's when the brain is producing natural, good brain chemistry, our own natural antidepressants, our own natural anti-anxiety. But when something traumatic happens, it disrupts our sleep. we get a shot of adrenaline when something happens to us. And we speculate that that is sort of nature's way of helping us survive. We get that shot of adrenaline. It's, fight or flight. And that's meant to save us. But when it becomes dysfunctional, it's when it gets locked in our brain. And then we are triggered by other things that aren't really the same, but may seem related. So like in caveman days, you see a big dinosaur, you run like heck, or, you fight. Yep. But when it becomes dysfunctional is when you see a big rock that looks like a dinosaur and you have that flight response. So with what EMDR does is it unlocks how it gets stuck in your brain. So it's like, it puts it back to how you normally would have thought and felt about a rock. I like to think of it like so this is for the older people in your crowd, like an album, a record player. And when things get stuck on the record player and it goes over and over, and EMDR just sort of, boop, just knocks it back onto its normal, regular groove.
Got it. Okay.
And then we wanted to do it with a blind person. So then what do you do there, right?
Right.
So, so what we discovered is that it's really the bilateral stimulation, something going back and forth. So you can do it with sounds going back and forth, or you can do it with tapping that goes back and forth.
Okay.
And then we have gadgets to do that, because after 7 years of doing this, my arm hurts.
I can see why.
Right?
Yes.
We have things like light bars. We have headsets with sounds that go boop, boop, boop. And then, or we have little buzzers go bzz, bzz, bzz.
So I'm curious, the rhythm of going back and forth and the speed, do you adjust that? Do you go a slower pace if someone is more in fight or flight mode, and then a faster pace if someone is more lethargic, or how do you determine that?
That's a great question. So what we do is and the instructions we give someone is that we want them to go to follow our fingers as fast as they can, but it has to be comfortable. So faster is better.
Okay.
The dual attention aspect of this is key. It's really meant to distract your brain, and then it moves into a calmer place in processing it. We go slow only when we're doing resourcing, when we're wanting to install a positive thought. But if we're going to process through a distressing event, we're going to want to go faster. And everybody's different. So as a therapist, you have to pay attention to their ability to track.
Right. And then we want the head still, right? We want the body still, and just allow the eyes to move, which can be hard. It sometimes takes some practice just learning how to do that, separate your eye from your head movement.
Right, right. So in general, most people can do that pretty well. And the instruction I give them is, okay, I want you to track my fingers as fast as you can without moving your head. And if I notice that you do accidentally, I'll just say, just notice your head. Yeah. But I have kids, I work with kids as young as 4, although we do have a very funny video of a 1.5-year-old toddler following the eye movements with their binky. So we have their pacifier, and they're like,
That's awesome. That's wonderful. I love it. So we only go lateral, right? No vertical with it?
Well, we can go, I mean, in general, what we're doing is horizontal.
Okay.
But sometimes we will go vertical, and we can also do different movements like the infinity sign, diagonal. So if people are stuck in the process, we're trained to change direction or speed because the client has become habituated to it. So if they're looping, then we have little tricks that we can do to kind of jumpstart it.
Okay. Okay, that's wonderful. So now, is there a difference then in doing EMDR with children versus adults?
Yes,
Okay.
in that adults are more abstract. So maybe I'll talk about it in terms of kids. It depends
Yeah.
on how young they are and
Mhm.
developmental stages that they're at. But the younger the child, the more concrete they are, the less abstract they are. The cool thing is for the most part with children, they process really quickly, like within 15 minutes. And oftentimes
Wow.
I'm like, are you sure? Are you okay? Let's do that again. So I wind up torturing them. And then also I have to do things, you know, you want to change it up. So sometimes I was showing this, Amy, this earlier. So we'll change it up with a variety of fun things for them to look at. So I have like little finger puppets. You can see my little teeth.
Yeah.
So we'll be like, follow, and we'll name the finger puppet and say, you know, follow my puppet, back forth. Or I have, you know, like a wand, it's all sparkly at the end.
That's awesome.
I have a green pen, but now that we're doing everything virtually, I do a lot more visual, colorful things. And then there are some online EMDR applications apps that we can actually share our screen with so that they can see. It's like
Oh,
a
neat.
ball that goes back and forth, and there's
Mhm.
sounds that goes back and forth. So
Okay.
yeah, so with kids, it's faster, they're more concrete. We kind of have to change it up. But yeah, that's the main difference with kids.
So, with these 8 phases that you go through this whole process, is it one session per one phase, or how does that work?
So, and this is a great question. It's a larger question. So when you, as a psychotherapist, when a client comes into you, what we're generally trained to do is to take a client history and find out why they're coming in
Okay.
and develop their treatment goals. And as you're doing that as a psychotherapist, you're also thinking about what modalities, what therapies that you think would be most helpful for the client. And EMDR is great. It integrates with all different types of therapeutic modalities. So oftentimes the client history takes at least a full session and the treatment
Okay.
planning. Sometimes if somebody has significant chronic and profound trauma, it might take 2 sessions.
Okay.
And then let's say somebody already knows about EMDR, then I'm going to spend the next session, you know, telling them a little bit more about it. So there's phase number 1 is client history and treatment planning. Phase 2 is the preparation phase, and that's where I'm explaining EMDR to them, much like I just did with you. I'm going to show them the variety of modalities of eye movements or sounds or tapping. And so now what we know too, when I'm doing it online, I'm either using some of those applications, or we have some of the headsets that people can purchase, or we can do one thing that's called the butterfly hug.
Yeah.
So
Neat.
you can have the client do that themselves, and also they can use this as a way to calm and comfort themselves doing the butterfly hug. So in that second, third-ish session, you're doing all the setup for it, and then you're doing this nice pleasant exercise that's called the safe place, which is where you're finding out an image or a thought that is pleasant, relaxing, and safe, or sometimes use the word calm place because some people have never had a safe place. And then we have them think about that. And that's where we use the slow, short sets that are calming to install that, because we would do it with the tapping in a slow way. And that's meant to be a calming thing that they can use in between sessions, as well as it's what we use at the end of a session if we have an incomplete processing session, to contain the session and stabilize them so that they can go home in a comfortable way.
Oh, that's neat.
So that's phase number 2. And then phase number 3 is the assessment phase, which is what I went through with you a few minutes ago, which is when So we picked what we're going to target. So let's say somebody is going through a divorce, and they're divorcing their husband because they walked in on an affair. And so they can't get over that, can't get that image out. So we ask in the assessment phase, the image, the negative belief about themselves, the positive, what they would like to believe, it's the goal, they usually don't believe it. Then we have baseline measures of how they feel about the positive on a 1 to 7, and 7's true, 1's false, and oftentimes it feels completely false when we start out. What's the emotion? And then we'd get a baseline on the emotion on a 0 to 10, with 10 being the most disturbing and 0 not at all. And then where do they feel it in their body? So if you notice those questions, they're all these different aspects of yourself. When we have these laser ways, it's connecting the mind body. It's an image, it's a cognition, it's a emotion, it's a body sensation, and then we have baseline. And we're not finished with processing until that level of disturbance is at a 0. The goal is a 0, and we can get it to a 0, and it's EMDR is about 85% effective. About 15%, it doesn't work. We don't really know why that is, but you know, it is what it is. But we're not done until the SUD's at a 0, and the 7 is, you know, it feels, the positive statement feels 100% true. So that's the 3rd phase. And then the 4th phase is the desensitization. So this, and really this, even though I spend very little time talking to you about it, that's the majority of an hour is, all I say is, what are you getting? Go with that. What are you getting? Go with that. This is not talk therapy. Yeah. So they have their bodies. It turns out our brains know how to heal themselves. It's just like if you get a cut on your skin and it heals itself, you don't need to like think about it or do homework about it. It heals itself. And sometimes it needs a little antibiotic, you know, ointment, and EMDR is sort of like that little, you know, ointment that you put on. So desensitization is the 4th phase. Okay. And then the 5th phase is the installation phase, which is where we're installing that positive cognition in, you know, by doing the movements. And we're still doing it quickly because we want any negative to still come out if it's there. And we're just shaking that apple tree to see if we're getting any other things out of there. And we're installing the positive. And with kids, that happens like super fast. Then, excuse me, I have my allergy cough because it's windy today here in Arizona. Yes. So, and then after that, we have the body scan. So we're saying, when you think about that positive thought, notice any kind of discomfort in your body. And if there's discomfort, that just means there's some cognitive dissonance between the cognition and their body accepting it. So we process through that. Oh, wow. And sometimes I might even take a whole session on that. So you wind up processing through that. And then we do the closure phase. And that's, even if it's, because it might take us 3 or 4 sessions to process through one target. And that's okay, that's normal, depending on the level, you know, especially people that have gone through severe abuse. So that might take, you know, 3 or 4 sessions, whatever. So the closure phase is about taking 15 minutes to make sure the client is stable, they're oriented to your office, and you give them some tools, and you do the safe place exercise for in between sessions. And then the reevaluation phase is my favorite phase. It's that's phase 8, and that's where you come back in the next session and you say, okay, when you think about that incident, how disturbed, you know, what comes up for you now? So you want to know purely how they're storing that still. Is it a thought now? Is it an image? Is it a cognition? And how disturbing is it to you now? Is it still a 10? Is it 5? Sometimes it actually goes up, not very often, but that does happen. But we just want to know. And then whatever they say, we're going to say, where do you feel that in your body? go with that. And again, our goal is to have that disturbance down to a 0.
That's fascinating. So when you're going through and you're doing the body scan, do people find, like you were mentioning earlier, a lot of people feel it in their gut. When they've kind of worked through the trauma using this process and you're doing the body scan and they may find other places, are there other common areas where people find that cognitive dissonance and that kind of that disturbance? And does it jump around?
Yes. And so I just want to circle back. I don't know that I completely answered one of your questions, like how to, on all of those phases. So like the assessment phase might be a complete session, and the desensitization phase might be like 3 or 4 sessions.
Okay.
And then, you know, so I don't want you to say, originally people thought this was like a super short form of therapy, and it's shorter for sure, but it's not necessarily short. If you have a single incident trauma, it might be 3 to 8 sessions. Okay. And it's done. So I just wanted to circle back around to that. So now back to your body scan question. So the reason I wanted to circle back is sometimes I'll spend an entire hour session just on the body sensation. Okay. So it may move around. So it just means that they're processing it in their body. So I've had sessions, I had one client who she is an ASU professor. She processed entirely in her body. Okay. Because she had witnessed something horrific as a child. Oh. And I think it was just too much for her cognitively to get the image of it. So she would say things like, my elbow's warm, go with that. Oh, okay. My stomach hurts, go with that. So yes, it can move around, but to get back to what I think you were asking is, are there stereotypical places that people experience things? Yes, and it's pretty interesting, especially when I'm working with kids, as I'll explain to them, because they may not have good emotional literacy or body sensation literacy. So I may need to spend a whole session on that, actually teaching about emotions and emotion regulations and how you feel things in your body. And so I'll say to them, you know, the cliches that we all learned, like, it's kind of true that when we get really upset with somebody and they're really bugging us, that they're a pain in the neck, or I have a broken heart, or if I'm really nervous about something, I have butterflies in my stomach, or I get weak in the knees. And so I do actually see those cliches. I think there's like a kernel of truth in all of those cliches.
Yeah. Oh, that's fascinating.
So hopefully that answers your question.
It did. So now, if someone has a multiple trauma background, do you address the trauma separately, or do you loop them together and kind of just spend more on one stage or one phase?
So when people come in with multiple traumas, which usually they do.
Yeah, unfortunately, yeah.
I'm like, I really want those single incident traumas, dog bites, car accidents, that kind of thing. Yeah. But so what clients will do is they come in, as they should, and say to you, I'm depressed. I just broke up with my boyfriend. So they'll have like multiple things. I'm not doing well with my supervisor at work. So they're presenting all of these scenarios and incidents. And as you're getting that history and doing the treatment plan, you're writing all of those things down. And then you're saying, which one of these treatment goals do you want to focus on first? And as a therapist, not only when we remember my favorite phase, reevaluation, which is checking in on, did it process, but also in the reevaluation phase, we're always circling back to the treatment plan of the treatment goals and saying, okay, number 1 is resolved, now we need to move on to number 2. So we're keeping track of all of those things. So let's say they say, I want to work on relationships, that's the most important thing. So then you're getting a history, and oftentimes you're finding out about their family of origin, their attachment issues, any abuse, and you're taking what's bothering them currently and what their negative belief about themselves is. And then, so we call EMDR the three-pronged approach. So it is, we take the present, we float it back to the origin of the belief. And so we do past, we do present, and process through present triggers. And then we move forward to the future and have them envision a future rehearsal of how they want that to be in the future.
Nice.
So let's say they're having trouble with relationships and their negative belief about themselves is I'm not lovable. Then we're going to say, when's the earliest time that you remember thinking or believing that about yourself? And then that's where there's probably going to be, and I encourage people to go back to their earliest years, because those are when those foundational beliefs are developed. And so, well, I remember when we were having dinner and my dad, who had a drinking problem, I knocked over my milk and he started screaming at me, and I felt like I was not lovable. So, and trust me, I'm giving you the mildest version. I hear terrible things, you know, that I don't want to traumatize you guys.
You're keeping it light for us.
I'm keeping it light for you guys. But I'm going to go with that earlier one. And as we're processing through, sometimes it just stays with that and we get that down to a zero. And, oh, I am lovable. My dad had a drinking problem. Mm-hmm. But there may be multiple incidents in there. And so we have protocols that help us cluster together traumas. And so this is, I was teasing Amy earlier, I was saying, well, this is a whole course that I'm talking to you about. But yes, so and so a lot of times if we have an incident and multiple other incidents, we always use this when we're talking about EMDR. So this is our target. We may, if we're processing through that, we may actually get a generalizable effect, and those other incidents may process out at the same time as we're processing the original event, which is kind of one of the super cool things about EMDR that makes it super efficient. Having said that, that doesn't always happen. So, but it does happen frequently, and it's what makes it more accelerated, I think is a good word.
Okay. And so we were talking kind of related to that because I asked you about enhancing performance. So I have a lot of people in my life who are endurance athletes, triathletes, ultra marathon runners, who always searching for how to get better. And part of being an endurance athlete is this huge mental game. I mean, you have to have the physical, but the mental will make you or break you. And I remember, you know, I'm at mile 75 of a 100-mile race, and I'm just like, okay, stick with it. I know I can do this. So I'm curious, there's a protocol that you would use for people who want to enhance their performance or athletes. Is that correct?
That is correct. So as I was saying to you early, Amy, so that what I'm talking about now and what you want from an EMDR therapist is for them to be proficient in all of the 8 phases that I just spoke with you about. And so once you get that down, it's sort of like a cake recipe. It's like, okay, now I know how to make a vanilla cake. And then there's a bunch of other recipes of how to make cake, you know, chocolate cake and pineapple upside down cake. So the same thing with EMDR. I love plain old traditional EMDR. And there's different recipes, we call them protocols, that are for things like performance enhancement, OCD, phobias. There's just a ton of different protocols. So in speaking to the performance enhancement, what oftentimes, so again, we're still using the same recipe basically. Mm-hmm. So if somebody is having difficulty, what you want to know is, as the therapist, is has that always been there, that difficulty, or has that just started recently? Like I once treated a golfer for the yips. So if somebody's having difficulty, and I have several clients that have run marathons, and so if their difficulty, psychological difficulty, is coming from an event that has happened to them, then that's going to be the thing that you process through, is the event that that started that. If it's not, then you're going to simply take the negative beliefs, kind of like what you were saying, Amy, like, I just don't know if I can make it, or I can't handle it.
Right.
I'm still going to ask the question, if you think about that negative belief about yourself, I can't handle it, when's the earliest time that you remember thinking or believing? And what's really weird about it, and people will be like, what does this have to do with anything? But it does. And so things that happen in our childhood that seem like completely different things, like I can't handle it, like I can't handle my little sister with her ADHD. If we process through, I can't handle that back then, it actually helps the current. And so then we do the past. So it's like I'm pulling on a piece of yarn, like in a sweater. And I'm like, where is this connected to? We process through the origin. We process through the current time, the last time that you were running or whatever. And then we do future. And we do over and over visualization and processing of imagining crossing the finish line. And I've actually just processed things with people without addressing their performance. I have one marathon runner who we processed he's a physician, through his trauma. And then he had a marathon run the next weekend, and he came back and he goes, I had the best time ever.
Aww.
And we didn't even target that, but that helped.
Oh, that's so neat. How cool is that?
So yeah, so there's a whole protocol around that.
Yeah. Now, in between sessions, do your clients get homework?
They don't.
Whoa! Oh my gosh. I am sure they love that.
They do love that. So if you get cognitive behavioral therapy, there's a lot of homework there. Okay. If you go through exposure therapy, there's a lot of homework, and nobody likes that therapy. Okay. But that's, the evidence is behind exposure therapy. So I don't want to say that that doesn't work, but people don't like the homework. So with EMDR, so remember, this is a physiological treatment. Yeah. This isn't, there's a psychological aspect to it, but if it works, it just shifts. Your brain chemistry just shifts it. Now, sometimes, we tell people that you may continue processing for the next 48 hours, up to 2 weeks. So your brain keeps processing it. You don't need to think about it. You don't need to purposely do anything about it. If it works, it's just going to work. Sometimes I get clients, and this is not something that we wanted to have happen, but sometimes they'll get like a little dip for those 48 hours. And that's where we have the safe place exercise for them to calm down. I always tell people, give me a call if you have a little moment like that, and we can kind of jump back in and process through that. But no homework.
Awesome.
Yes.
I don't remember what that's like.
I know. Well, I only ask them to just pay attention. Yeah. I tell them that it's not unusual for people to have a dream the night of or the next night. We call that a processing dream. Okay. But they may have thoughts or images that come up that may seem related, and for them to just jot it down for me. Okay. And then when we come back for our next session in the reevaluation, I'm going to be like, okay, so when you think about driving over bridges, what happens now? Have you had any more thoughts about that? And so they're going to give me that information, and then I'm going to know how to jump back in and how to process that.
That's wonderful. Now I'm curious. So we talked about, so there's various traumas, depression, divorce. Like, are there any we know like a lot of common traumas out there. Are there any other like different things outside the box that this helps with that, we wouldn't think? Obviously like injuries or those types of things are traumas. Is there anything else that it helps with? I was surprised by the performance enhancement part. I was just curious if there's anything else.
Yes. Well, you know, it helps with like with kids that are having trouble sleeping at night and figuring that out.
Okay.
It's usually connected to something.
Okay.
Oftentimes it's connected to medical trauma that the parents don't think is even significant, like getting
Okay.
ear tubes.
Oh, wow.
Because people will say things to kids like, well, you're just going to go to sleep now before they put the mask on. And then they wake up after a tonsillectomy and they have a severe pain.
Yeah.
And so what happens is then they link in their brain sleep and pain.
Oh, okay.
So then it's the therapist's job to figure out whatever symptom that's coming up and how that may be maladaptively stored in their brain so that you can process through that. And then, you know, I work a lot with people with ADHD. I work with gifted kids and adults, and they have a lot of trauma out of social trauma, academic trauma, of not fitting in, not belonging, doing a lot of EMDR around the pandemic, political stuff going on. People are very traumatized about those things. So it's pretty applicable
Right now, yeah.
Uh-huh.
We have a lot of trauma, and I imagine having this type of resource to help people get through it. I mean, that's huge. I mean, to be able to have that. So when you were going through training, and now how long is the training process to learn EMDR? Is it a course, and then do you work with someone who, you know, you practice it on each other? How does that work?
Good question. So we start with the baseline of, you know, you have to have a minimum of your master's in a mental health psychology type degree. So
okay.
all of that, you know, and some people are interns going through, they can go through the process, but for them to be get their completion certificate, they have to have all of this. So I'm just saying that's all in line. So whenever you get EMDR, you're getting it from, if they're EMDRIA approved. EMDRIA stands for EMDR International Association. And EMDRIA.org is what I would encourage you guys to, if you're interested in looking this up, and you can find a therapist in your area by putting in your zip code. I am completely full, so I'm doing this as a service because I think this is such an awesome treatment for people. But yes, coming back to your question, which was, oh my gosh, I just got off. What was it you were asking?
Your training, like what training you have to have.
Okay.
Yes.
So the training, that was way off. So the training is 2 weekends where you're getting 40 hours of training. So it's 3 days straight. In the morning is lectures, and then the afternoon is practicum, where we practice on each other. And then so we do like weekend 1 training, and then we do 5 hours of, the participants do 5 hours of consultation with an EMDRIA approved consultant. Then we do the weekend 2 training, and then they do another 5 hours. And then that would qualify them for having a certificate of completion. It doesn't mean that they're certified, because they need to kind of be practicing EMDR, doing EMDR for a year, and then going through the certification process, which is much more, which is very rigorous. It's sort of like oral boards where you're demonstrating proficiency.
Got it. And then now you're an instructor of it as well. Is that you teach others?
Yes. So I'm a consultant. So I'm like the person that if they need, you know, they need those 5 hours, they would come to me. And then I'm also a trainer. I was been privileged to have trained with Francine Shapiro, the originator of EMDR. So she trained me and a variety, you know, other people to be trainers. So yes, and so I also belong to the Trauma Recovery Network, the Humanitarian Assistance Program, where we go in, we volunteer our time and train other therapists to do EMDR. And I've, had the honor of going in and training therapists about 6 weeks after Hurricane Katrina
Oh my.
on how to do EMDR. I flew into Newtown, Connecticut, and trained therapists there 10 days after the shooting of the children.
Oh,
Very,
gosh.
very intense. And so our idea is to go into the communities and train the therapists there and provide support to them. And we're doing that as a humanitarian outreach.
Wow.
And supporting them in that process. And I've done that in India and Japan. And
Yeah. Do you find any differences related to culture when you go to the other countries in terms of like their baseline of what they use for psychotherapy and their knowledge? And then, because obviously there are so many cultural differences out there and people have successes all over the world. So when you're training for the EMDR, do you take a step back to say, okay, this is where we're coming from and this is where we can go, just so you're on the same page?
Yes, 100%. And so we rely very heavily on the EMDR therapists that live there in the community to be able to translate for us, to be able to tell us how cultures think and work, and to understand our own limitations as therapists and understanding that diversity aspect. So in India, what I learned, which was pretty fascinating, is that that in their culture, and this is from therapists, EMDR therapists there, that people in India experience their emotions more in their body than they do labeling it as emotion. So we would focus more on the body scan aspect and the body issue more than trying to get them to name an emotion. In Japan, where they're very much communal, and we were instructed by this from the Japanese EMDR therapists there, that to ask them an I statement, what's the negative belief about yourself, was very hard for them because it was about their community.
Got it. Wow, that's fascinating because I love culture. This is beautiful.
Isn't it interesting? And then even here, if I'm working with someone, let's say they're Hispanic, but their first language is Spanish, I'm going to want to get their negative belief about themselves in Spanish.
Makes sense. Yep.
Because you feel it so much more organically if it's in your language of origin.
Yeah, and that sometimes the translation gets lost, and I speak French and Spanish, and so there have been times where it's something is said in another language and I'm like, okay, how do I really say that in English? It really means what it is that person is saying to me, because it's so different. But oh, that's fascinating that you've been able to do that and to notice those differences as well.
Yeah.
So any other last little things as we wrap up here? You've provided us so much good information. Any other little tidbits you'd like to share, or anything else you think that I didn't cover or ask you?
I think you were super thorough, and I really appreciate the opportunity to share about EMDR. We have probably 80,000 therapists all over the world that are trained in it. So I'm encouraging, if people are interested, go on the EMDRIA.org website and explore that, read up on that. And if you're wanting a therapist for that, to look for somebody in your area. Because I'm trained in a lot of modalities that are really wonderful, and I do use them on a regular basis. But the reason I was a total skeptic about it. So for the first, so I took the weekend 1 training, and then I didn't get the weekend 2 training for 2 years because I was like, how is this working? This can't be working. But I kept doing it and it kept working. So, and I'm a real skeptical person, and you kind of want skepticism to be able to prove, because it seemed like this is just this is not how you get trained in school.
That's fascinating. So the website to find people is emdria.org. And then if people want to, just if they have a question, in addition, I kind of filtered everything here, but if they have a question, they can reach you by email?
Yes.
And that is, can you say that
Settle,
one?
Yeah, Settle, SETTLE .Carolyn, CAROLYN @gmail.com.
Okay.
Or you can check out my website, carolynsettle.com, because there's a lot of information on that.
Right. And I will put that in the comments as well, so that way people can have that. But we really appreciate having you on today, and just it's great to learn about new topics and modalities that are helping people around the world. And I know that sometimes you just have to meet the right person and find the one that works for you. So it's good to have someone, especially as well-versed as you are in this, come in and explain it to those of us who are new to it. So.
Right. Well, I'm glad for the opportunity, and hopefully I didn't talk too much, but.
No, you did fabulous. You did wonderful.
Well, good.
You can do your little thing with us right now.
That's right. I will say bye-bye. We're going to have a good and pleasant Sunday.
Awesome. Well, thank you very much. And all of you, thank you so much for joining us today. We'll see you again next weekend for another episode of our Weekend Wellness Hour. Thanks again, Carolyn, for joining us today.
Thank you for all that you do, Amy.
I appreciate it. Bye, all.
Thanks. Bye-bye.